Endometriosis and fibroids is something that we hear commonly today, where women say that they have been diagnosed with it.
Well, endometriosis is that the lining of the uterus, or the endometrium as we call in medical terms, it starts growing outside the uterus.
Is there a symptom to diagnose it? Is there a treatment? What causes it?
Well, the patient, the first thing that a person can say is, my periods are very painful.
There is also a condition known as fibroids.
Fibroids are the most common tumors or benign tumors that we know of, and they are in the uterus. We've had lots of couples who've come who were told that maybe you cannot conceive, but they went very nicely with a live baby that's not there.
Hello and welcome to Fertility Tales powered by Nova IVF, the podcast that brings hope, insights and clarity to your fertility journey. I'm your host Simrat. In today's episode, we delve into a topic that many women experience during their reproductive years, fibroids and endometriosis. Joining us to unravel these layers is a senior specialist in infertility in India with over 30 years of experience, trained in France. She is an academician and currently trains fellows for IVF. Her expertise lies in recurrent implantation failure, and she has published numerous papers and contributed to various chapters for Springer and GB publications. She has also served as an inspector for F&B Accreditation of Hospitals. She is none other than Dr. Sonu Talwar from Nova IVF Delhi. Dr. Talwar, it's a pleasure to have you with us today.
Thank you so much.
Doctor, with the span of 30 years in your career, you virtually have experience in all facets of infertility, I'm sure. What are the common causes of infertility in women that you can think of?
See, for a normal pregnancy to happen, an egg has to get released from the ovary. The tube has to come and pick it up, and the sperm has to fertilize, and the embryo has to get implanted into the uterus. So this is the normal thing. So anything which hinders this process, if we talk about the woman, let's not talk about the sperm, then the egg has to form and it has to get released. So the ovulation problems are the problem with the ovary. And the second thing would be the mechanical things. The tubes are blocked, or there is something in the uterus which hinders implantation due to any causes. So anything which disrupts this normal process is going to cause infertility.
Okay. Doctor, what are the more familiar causes of infertility in women? For example, endometriosis and fibroids is something that we hear commonly today, where women say that they have been diagnosed with it. Could you tell us a little bit about these conditions and what causes them? Let's start with endometriosis first.
Well, endometriosis is that the lining of the uterus, or the endometrium as we call in medical terms, it starts growing outside the uterus. It could be in the muscle of the uterus when we call it as adenomyosis. It could be in the ovary, or it can go to different other organs. It can even go and affect things like rectum or intestine or small intestine or even skin. So we call it as ectopic endometrium. That is, the site is not where it is supposed to be growing. It grows at other sites. And if it is growing at these other sites, then under hormonal influence, it's going to have all the same properties like you have in a normal menstrual endometrium. So it's going to undergo those changes. So this is what is endometriosis, and this will present in different ways depending on where it is located. Ovarian endometriosis being the most common site, as we call it. So if the endometriosis is in the ovary, then you're going to start having blood-filled cysts maybe in there. So that's a common kind of endometriosis that we know of. So this endometriosis, if it is in the ovary, then what is it going to do? It's going to occupy the site wherein normally you're going to have the eggs being formed there. And if there it is being occupied by something else, or the ectopic endometrium which is going to be there, it's going to take that site over. And the blood-filled sites are going to make sure that your ovulation or the egg reserve or the ovarian reserve is going to be compromised, because you have a tissue which is not the normal ovarian tissue. You have something else which is growing there. And what is it doing? It's not causing, it's taking that space of the ovarian stroma, as we call it, and it is something else. It is these blood filled things, and they are going to hinder your development, and it's going to compromise the ovarian function.
So it has a direct impact on your fertility.
It has a direct effect, and not only does it do that, it can affect your tubal transport depending on where it is. Then it causes certain hormonal changes, it causes immunological changes, and it even hinders your implantation. So it is working virtually at all levels of fertility. So it's going to have different changes because it's affecting various aspects.
Is there a symptom to diagnose it? Is there a treatment? What causes it?
Well, the patient, the first thing that a person can say is, my periods are very painful.
Painful periods.
So you have to listen very carefully when the patient comes to you. You are supposed to be taking history, we call it as a gynae history. You are supposed to be taking the symptomatology, and then there is something called as menstrual history. How carefully have you, listened to what the patient has said? She says, I have excruciating pain, could be one symptom. She's a married girl. She says that when we are having intercourse, we are having a lot of pain. So be very, very kind of vigilant and empathetic when this history is being done, because this will guide you maybe that this is what we are dealing with, and then we later on we can diagnose it. I'm not saying it's directly proportionate. Pain and this thing may not be directly proportionate, but this is what will kind of alert you that this may be endometriosis, or we may be dealing with endometriosis.
Okay, so symptoms that a woman should look out for could be painful periods,
Yes.
Pain during intercourse, and any other symptoms that could superficially appear?
Well, she could even come to you with a ultrasound. So many times these days, people just show us, ki ji, you just see the scan, it shows something. And there could be an ovarian endometrioma which is written in the scan. So the presentations will differ. And if, say, she's having endometriosis as a different site, she may even have painful, when she's having, she's passing stool, she may be having something we call melena. Depends if it is in the gut or it is in the, it is going to start mimicking the symptoms of the site that it is in.
Okay. And what treatments are available for endometriosis? Is it reversible? And women with the endometriosis, can they have a natural conception, or are there fertility treatments available?
Well, it will depend on what is the stage of endometriosis that we are looking at. These days, we have something called as endometriosis fertility index, wherein we grade the endometriosis depending on, how big the endometriotic lesions are, what is the history, what is the age. So on the stage of endometriosis and on the age of the woman and the fertility potential, it will depend on whether endometriosis is going to cause infertility at all, how bad it's going to be, and what is the treatment you need. In a younger woman with maybe earlier stage disease, or she does not have a very advanced endometriosis, the ovarian endometrioma is not present, it's just early and beginning, then maybe you can, tell them, she's very young, you can say, okay, you have 6 months to a year to plan, the semen parameters are also okay. But if this is the stage is, a higher stage, or the age of the woman is more than 35 years of age, or the semen parameters are something which are compromised, then you can't be waiting. Or you have a diagnosis of ovarian endometriomas, and you can't be telling her that, no, wait for 6 months, 1 year. No, it won't work. So it depends on what is the presentation, what stage the woman has come to you, and the woman who has come to you, what age is she at?
Okay.
What are her ovarian reserve parameters? What does her ultrasound show you? Are we seeing some follicles there? What is, if one ovary is compromised, what is the second ovary looking like? What is the hormonal function telling us that how it is? And the semen parameters are also going, because you're not treating a woman as such. If the man is fine, but the woman is also say it's all okay, then you could try. But if things are looking bad from the woman's side, then maybe even if the semen is okay, you won't try for a longer time. You will go for some advanced treatment if depending on what we are dealing with.
That's true, doctor. So this covers the endometriosis part of the conversation. There is also a condition known as fibroids. Could you tell us a little bit about the condition? Why do they appear, and how can they be treated?
Fibroids are the most common, tumors or benign tumors that we know of, and they are in the uterus. And these fibroids are derived from the smooth muscles, and there are lots of theories as to how do they develop or what all they are related to. But depending on where they are placed, the symptoms will vary. And depending on their place of origin will depend on whether they need treatment, what kind of treatment is required, or no treatment is required. So if they are in, so let me just talk, I'm not going to talk about staging and all, that doesn't come in our purview. Let's talk in very layman terms. If the fibroids are somewhere just near the uterine cavity, they are going to have problems, because this is where the embryo is going to come and get implanted. And if that is where the fibroids are, the implantation is not going to happen, or if it happens, then maybe there abortions will start happening. So it will start acting as an intrauterine contraceptive device or a copper T. So then that means they should be removed.
Okay.
And then if they are in the muscle, what is the component of the fibroid in the muscle? They could be half in the muscle and half in the cavity, entirely in the uterine musculature, or they are somewhere outside, something. And those are the ones, the further they are away from the cavity, the better is their chances of affecting you. The more they are with, and then the size.
How can a woman be actually diagnosed with fibroids? And once they are diagnosed, what are the treatments available? Is surgical intervention the only way to treat fibroids? Or can they be dissolved with medication?
Well, it depends. The symptomatology could be, you could have a heavy bleeding, or you can start feeling that I have something in my abdomen. If it's a big fibroid, she can just say, I have heaviness. I have something like, it's feeling that there is something inside. Sometimes we see fibroids as big as maybe a 3 months old pregnancy. They are so huge. So when you we say on medical terms, we say palpation. You just feel the abdomen and you see, oh my God, it is like having a 4-month or a 5 months pregnancy.
And this is just a fibroid.
And it is just a fibroid. So they can just go, or the patient has menorrhagia, it could be there, excessive bleeding could be there, it could be that. So patient can present in different kind of, or she may be just, it may be just, she's just unaware, and it is just an accidental diagnosis. You're just evaluating a person, you are doing a scan, and then you may just come across that as an accidental finding. It may be just not associated with any symptoms per se. So depending what treatment will be required will depend on where they are placed, how big they are. And if you feel they are going to hinder your treatment in any way, then definitely they need surgical treatment. But having said that, surgical treatment itself is also plagued with certain problems. Because once you remove the fibroid, if you're going to scar the uterus, then maybe you're, hindering the chances of pregnancy. Say we are doing an IVF and we've removed the fibroid before that. So how well you have removed the fibroid, how good you've done surgically. If you're going and scarring the uterus, maybe you've done more harm than doing any good. So you have to exactly know at what time you should be operating, what is the way, what method you should be using to operate the fibroid, and when you should not operate is also very, very important thing. We always say that a good surgeon is the one who knows when not to operate. So everything has to be taken, the patient symptomatology, where they are placed, if they are actually causing infertility or no.
Okay. So what if a fibroid is left untreated? Is that also a possibility?
Well, if it is a big fibroid, it can grow. So if you are leaving it untreated, then kindly leave it with supervision. You should be doing a serial ultrasound to see, are they growing? Because there are chances of it even becoming malignant, although the chances are very less. But there's something called as leiomyosarcoma, which is a malignancy in the fibroid, which could happen at times. So even we are talking about this problem, it may be looking benign, but if you are, if you know the fibroid is present, then kindly look as to what is the growth. Just follow her up, do serial scans, because it's not only infertility and that's not the be all and end all. Our goal is to have a woman to have a healthy life.
Yeah.
It's not the only goal to treat fibroids or endometriosis. It's to give her a healthy life. So that's very important. Whatever we do, she has to live a healthy life. That's what is more important.
So it's very important that the gynecologist and the surgeon are able to help you with your life choices and how you want to deal with it. That's very important. To our listeners who are actually wanting to start their journey towards fertility and parenthood, can you explain what are the types of fibroids within the gambit of the types and what impact they have on infertility?
So I told you there could be something which are in the cavity, we call them submucous.
Okay.
They are inside the cavity. Now they are going to affect your fertility chances. The submucous, the intramural can affect, especially if they are big fibroids, maybe more than 5 centimeters. Then the subserosal, the ones which are outside, are not going to affect that much. So if you are going to start your fertility journey, then to know exactly where the fibroids are will tell you whether you need any intervention or not. If they are submucous or intramural, I'm not talking about the FIGO classification, which is difficult to explain to a lay person, but there are different classifications which will just tell you that whether they require surgery or not. If they come into these two gambits, then maybe the surgery is required. They will be required. But if they are outside, they are doing nothing to you, then kindly leave them alone. Because operating is not going to get you any better outcomes.
That's true.
So when we are talking about any of these things like endometriosis or fibroids, we should know when to operate and when not to operate.
When not to operate. Do fibroids or endometriosis, these conditions, do they cause recurrent pregnancy loss?
Endometriosis will not cause recurrent pregnancy loss. It can affect your fertility status per se. But fibroids can, especially if they are in the cavity or the submucosal ones, which I said. They can cause recurrent losses.
Should women with fibroids consider preserving their eggs before starting fibroid treatment?
Well, if they are young girls who are not planning to have a family right now, or maybe they are married but still they are not considering having and they have huge myomas, one can go in for a fertility preservation. That is an option. Because we know that the ovarian reserve or the egg reserve is going to fall with age, especially if they are, say, in their 30s. And we have huge fibroids, then it's worth considering.
Doctor, does endometriosis affect egg quality in women?
It does affect the egg quality. The number of eggs will also go down and the quality is also hampered. It does affect the egg quality. In some cases, yes. When it is an ovarian endometriosis, it could affect the egg quality.
Then what are the options available for somebody who's trying to conceive naturally?
Well, if she's trying to conceive naturally, it is very important. If it is a big endometrioma, and it will depend, actually, if you're going to treat an endometriosis patient, what modality you will use will depend on what is her age, how many years she's married for, has she had any previous surgery, does her ultrasound show an endometrioma, how big it is it in one ovary, is it in both the ovaries, and the partner's parameters. So if it is an early stage disease and she is young, then you can, and she's just married for say 2-3 years, then you can offer even an IUI or intrauterine insemination. But if that same patient is maybe near 35 years of age and she's been married for 7 years, 8 years, and the stage of disease is higher, she has an ovarian endometrioma, a big endometrioma, and she's had a surgery, then 100% IVF. So if you have an ovarian endometrioma, which is considerable, and you fall into this disease of stage 3 and stage 4, or even if it's stage 2 and you are a woman who's more than 35 years of age, then kindly think, even if you're not married, kindly think of preserving your eggs. Because maybe after 2-3 years, you won't even have that option with you.
So endometriosis as a condition can progressively get bad to worse?
Yes. And the imaging also, it will depend. Then when you are doing your ultrasound imaging, if you find anything suspicious, then also you should be very vigilant about it. There are certain things called as tumor markers which should be done. So everything has to be seen, as I said even earlier, when you are looking at a woman, it has to be a holistic approach. It can't be just infertility and forgetting other parts.
Right. Fertility health also is a big parameter of overall health for women.
Exactly.
So should a couple start early if they are diagnosed, if the woman is diagnosed with endometriosis? Is that also a condition?
Exactly. If the woman knows she has endometriosis, then maybe she goes for an earlier consult than a person normally would. If a normal person, we say 6 months to a year, if she should probably, the minute she starts thinking of conception, she should come for an advice and look at her ovarian reserve parameters, do an imaging, see how big is the endometrioma, see other things. So then maybe that's required much better, much earlier the better.
Doctor, what would be your advice for a couple who has been diagnosed with endometriosis for the lady, and what would your advice be? How can they even conceive naturally? If not, then what should be their first course of treatment?
Well, if they can, if they are young, then they can be given a chance. An earlier stage disease, they can be given a chance for a natural conception or maybe intrauterine insemination. But if the disease is advanced and they've been married for a long time and they are older, then straight away you should go for in vitro fertilization or IVF.
And what about fibroids? What would be your advice for a lady who has fibroids and wants to plan her pregnancy and is also planning her pregnancy in the near future?
Well, we know that 2 to 3% of women with fibroids will have infertility. And whether you're going to treat or not to treat will depend on the size and location of the fibroids. So if you feel it's going to hinder with your pregnancy or your fertility treatment, then kindly remove it. If you feel that no, it is not going to hinder, then just go ahead, try. And it depends on if it's a huge fibroid, it's located inside the cavity, then remove it. If you feel it's not going to hinder in our main treatment, then we can just leave it also.
Doctor, any case studies, any interesting cases that you've come across for women suffering with endometriosis who have been able to conceive or not have been able to conceive? Any interesting bits that you would like to share with us?
I've done lots of cases who've had endometriosis, and it's actually an art maybe to do an egg retrieval in those cases, because you don't want to puncture the endometrioma. You want to go from the side, you want to pick up the eggs, and they have good pregnancy rates. It's not that the woman is not going to get pregnant if she has endometriosis. So please don't lose heart. It depends on so many other things. You can get pregnant. The only thing is that try and come as soon as possible, as early. Lots of patients who have conceived with endometriosis. That's not a thing which you should get so worried about. We've had lots of couples who've come who were told that maybe you cannot conceive, but they went very nicely with a live baby that's not there.
That's wonderful. There's a lot of hope within this. And any case studies when somebody has had fibroids and has been able to conceive?
So we had this case patient who had multiple big fibroids, and she was around 35 years old, and she'd been married for 7-8 years. So we did IVF. We retrieved eggs, maybe just 4-5. We made 3 embryos, and we preserved them. Then told her to get surgery done. She had a myomectomy. After 4 months of myomectomy, laparoscopic myomectomy, I did a transfer and she has a live baby.
How lovely. Doctor, it's been a wonderful conversation with you and so insightful to understand all these underlying causes of infertility and how to manage them. And also, the biggest takeaway that it's your overall health also that matters, and not to overshadow that. Thank you so much, Doctor. It's been a pleasure talking to you today.
Thank you so much for having me. Thank you so much.
To our listeners, thank you for tuning into Fertility Tales powered by Nova IVF. We hope today's episode has shed light on endometriosis and the way forward to understand fibroids as well. Join us next time for empowering stories and expert advice on your journey to parenthood. This is Simrat signing off from Fertility Tales powered by Nova IVF. Remember, you are not alone. Share, like, and subscribe. Thank you.